Hi everyone! Today we're talking about medical abbreviations used in medication orders. These shorthand terms are everywhere in healthcare, but they can cause serious errors if misunderstood. Whether you're a nurse, student, or healthcare provider, knowing which abbreviations to use and which to avoid is key to safe medication administration. Let's dive in. In general, abbreviations should be avoided in medication orders. It is best practice to use the full medication name and provide clear instructions for medications, including doses and frequencies, whenever possible. But abbreviations are commonly used in real-world clinical settings. They persist for a few key reasons. First, they are time-saving. Abbreviations help providers document faster. Additionally, many clinicians have been trained to use specific abbreviations, and they continue to do so. And many electronic health records use standardized abbreviations, which gives a false sense of safety, even if some abbreviations remain problematic. So, nurses must be familiar with the abbreviations used in medication orders to ensure accurate administrations. So what is an abbreviation? Abbreviations are a form of medical shorthand. They're shortened forms of words. Misinterpreting an abbreviation can lead to medication errors, including administering the wrong drug, incorrect dose, or administering it at the wrong time or route. This can result in harmful or even fatal consequences. Hospitals standardize abbreviations to ensure all healthcare providers interpret documentation consistently. Always check the approved abbreviation list at your institution. Let's start by looking at common abbreviations used in medication orders. Here are the 4 parts of a medication order. The first part is the name of the medication. The medication name should always be spelled out in full. The second part of a medication order is the dosage of the medication. Let's look at standard abbreviations used in dosage. Here is a list of the most common standard abbreviations used to indicate the dosage or the measurement of a medication. Milligrams is abbreviated as mg, micrograms as mcg, milliliters is ml, grams is g, teaspoon, tsp, tablespoon, tbsp, drop, gtt, tablet, TAB, and capsule, CAP. These are the most common ones that you will see. Now, let's look at standard abbreviations used in the route of a medication order. PO stands for by mouth or orally. IV stands for intravenous. IVPB stands for intravenous piggyback. IV push means intravenous push. IM stands for intramuscular. SUBQ stands for subcutaneous. You should avoid writing SQ. That can be mistaken for sublingual, or the Q in that can be mistaken for every. SL is sublingual or under the tongue. TOP is topical, applied to the skin. PR is per rectum. And INH is inhalation. Now, let's look at the standard abbreviations used in the timing of a medication. BID stands for twice a day. You can remember that because there's 2 wheels on a bicycle, so the B goes with BID. TID is 3 times a day, and there's 3 wheels on a tricycle. QID stands for 4 times a day, and there's 4 wheels on a quad. PRN stands for as needed. STAT stands for immediately. AC is before meals, while PC is after meals. A is before P in the alphabet, so it's before meals. P is after A in the alphabet, so that's a way to remember it's after meals. Q for H is every 4 hours. Q stands for every, so when you have every 4H, it's every 4 hours. When you have Q6H, it's every 6 hours. HS is at bedtime. And QD is in here. It means once daily, but this one is often discouraged. they would rather you write out the daily because it can be mistaken for QID. But you will see this very frequently written out in the medication order. Now let's look at abbreviations that should not be used in medication orders. Do not use abbreviations for medication administration are specific abbreviations that healthcare professionals are advised against using because they're commonly misinterpreted, and they can lead to medication errors. The Joint Commission, which accredits healthcare organizations in the United States, has published a do not use list as part of its national patient safety goals. These recommendations are based on frequent errors specific to these abbreviations. The first one is U, which stands for unit. It can be mistaken for 0, the number 4, or CC. Always write out unit. IU, which stands for international unit. This can be mistaken for IV, intravenous, or the number 10. Always write out international unit. QD, which stands for daily. This can be mistaken for QID, or 4 times daily. Always write out daily. QOD, this stands for every other day. And this can be mistaken for QD or QDay. QID, which means 4 times a day. Always write out every other day. Trailing 0. Always avoid having trailing zeros. What is a trailing 0? It means you have a number and then you put a decimal point and a 0, like 1.0 milligrams. If that decimal point is missed, it is often read as 10 milligrams. So instead of writing 1.0 milligrams, just write 1 milligram. No trailing 0. Lack of a leading 0. When you're writing a number like 0.5, you want to have a leading 0, 0.5 milligrams. If you just write 0.5 and that decimal point is missed, they will read it as 5 milligrams. So write 0.5 milligrams. Any number 0.5, put a 0 before it if there isn't another number. Always use a leading 0. MgSO4. This stands for magnesium sulfate. This is the name of a medication. It has very, very frequently been mistaken for morphine sulfate. So always write out the full name of a medication name. Specifically, this one is magnesium sulfate. MsO4. This is the name for morphine sulfate, and it's very often mistaken for magnesium sulfate. So always write out morphine sulfate. Remember that medication names should always be written out fully. Nurses should not use text abbreviations. Use only your approved list of abbreviations at your institutions. There is a risk of misinterpretation with text abbreviations. They are not universally understood and they are unclear to many. Standardized language ensures a consistent understanding. Key takeaways. Number 1, when writing verbal orders, use full drug names and directions. Number 2, use standardized approved abbreviations only. Number 3, avoid all do not use abbreviations. And lastly, question any medication order with abbreviations that are unclear, ambiguous, or potentially unsafe. Thanks for watching. If this video was helpful, give it a like, share it with your classmates or coworkers, and subscribe for more nursing education content. You can find more videos at nursevideohub.com. Watch, learn, and care.